Our next two presenters are absolutely dedicated to improving health and quality of life in our area, and they've worked tirelessly over a series of years to do just that. Dr. Susan Turner works with Dr. Lanza and serves as Associate Director for the Florida Department of Health in Escambia County. Dr. Turner is a board-certified family physician with an in-depth understanding of factors that contribute to poor health status. And this morning, she's going to help us understand how the three health improvement priorities that we're going to introduce to you today were identified. And then Dr. Debra Vinci is an associate professor with responsibility for community health education and the master's program in health administration at the University of West Florida. Her research interests are on community coalitions and reducing and preventing obesity, but she's going to talk about, after we identify three priorities that we need to work together on as a community, what are some of the things that we can do about that? What are some interventions that we as organizations in the community can undertake to try to address those and improve our health status? So Dr. Vinci will follow Dr. Turner, and she'll include things that have worked well in some other communities that are things for us to consider. So with that, I'll introduce Dr. Susan Turner. Thank you.
Thank you very much. I'm hoping that you'll indulge me for one moment before I start my portion of the discussion. And I would love to see a show of hands of those of you who have already participated in some kind of moderate exercise, walking, some kind of moderate exercise this morning for 30 minutes or more. A show of hands, please. Wow, that's really very cool. All right, thank you. And now, so I would also please like to see a show of hands of those of you who have planned in your schedule today to do 30 or more minutes of moderate exercise today. Wow, that is just awesome. That's an applause to you guys. All right, so thank you very much for that. That is just really awesome. When I ask health department employees that question, we get about that similar show of hands, and I really appreciate you indulging me for just one moment as I ask that question. And so, really appreciate your attention today. I feel very privileged to be on this docket of speakers and panelists. And I really want to illustrate, well, if I can get that to work. Yes, there we go. That health is more than health care. We've talked a lot about health care and the costs of health care. I hope to illustrate that health is much more than health care. I'm just going to slightly touch on the favorable conditions. Some of this was already done by Mr. Faulkner. Unfavorable conditions for our communities. As Mr. Schoberg mentioned, I'm also going to discuss disease root causes and the reasons we're sort of focusing your attention down to three more narrow focus areas, and then introduce the concept of changing the context that Dr. Vinci will continue as she enters her discussion. So this pie chart, it's not a squiggly graph, but it is a graph, sort of. Helps me to explain that while talking about poor health and moving the dial, as some people have said, may seem overwhelming because not everyone in our community has access to health care, and we all know relatives, every single one of us has relatives with diseases that run in the family. So between the two, lack of access to health care and genetics, we're doomed to poor health, right? Because everybody we know gets sick. But actually, that's really only 30% of health outcomes. Those contribute about 30% to health outcomes. These other factors contribute about 2/3 of what determines our health: poverty, education, race, ethnicity, personal choices, and where we live. We're going to focus on kind of the last two today. And so now that said, that healthcare access plays, along with genetics, about 1/3 of our health outcomes role. There are some types of healthcare that are absolutely essential to preserving health, to preventing disease. And I'm a sucker for cute babies, you can tell. And those kinds of exams are prenatal exams, well baby exams, well child exams, oral health exams in children. And then as the children start to get a little older, they start to be early teens, mid-teens, actually those visits start to turn into something else. And as they turn into adults, they turn into something else. Actually, their health care is sick care. The health care visits find disease. They diagnose disease. They're not really about preventing those diseases, although they are critical to the health of our community and the health of individuals, in that they help control the consequences of those diseases. But they really don't result in health. They result in improved disease control. And so looking toward health, I wanted to present to you the World Health Organization's definition of health, which I believe applies not just to individuals, but also communities. And note that health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. And I'm just going to touch on our favorable conditions, mostly just to say, as a reminder to me to say, these are things that are that people like to work on, and as we move into our discussions to move the dial in our community, these are things that are already favorable for us. They're not perfect, but we really need to focus our attention on our black marks. And I've only listed in these next two slides in no particular order our most unfavorable conditions compared to peers in the state. They're not all of them. And so you can see arthritis, disability, female breast cancer, asthma, smoking, teen birth, sexually transmitted diseases, poor birth outcomes. I left in red. Poor birth outcomes is almost a euphemism because, in fact, in our communities, African American babies have 2 to 3 times the chance of dying, the risk of dying. They die 2 to 3 times more often as a rate than Caucasian babies. That's worse than several third world countries. Our counties are worse than several third world countries. And so I just didn't want to let that pass. Our community should not stand for that. Again, unfavorable, early loss of life due to cardiovascular disease, stroke, lung disease, or COPD, diabetes, very much like the national pattern, although worse than peers in the state. And then, as was already mentioned, visits to the emergency department for things that should be taken care of in a doctor's office, resulting in busy emergency departments. And so why care? This is the slide I'll spend the most time on of all of them. I would like you to follow with me, if you would, please, from the left to the right of this slide. As we start at the left of this slide, you'll see there's at the top a gentleman in a wheelchair, a double amputee, probably related to some diabetes or high blood pressure, some vascular disease. And then in the lower left corner, you see a victim of a stroke. And you'll notice that both of these gentlemen are not what we would have seen these afflictions in previous generations. I would say they might be in their early 50s, mid-50s, late 50s, it's hard to tell, but in their 50s. That would not have happened in previous generations as a general rule. And then as we follow to the right, I'd like you to look at the gentleman in the middle at the top. I'm not great at guessing age, but he may be in his 40s, and he's on a dialysis machine. He's undergoing dialysis, probably related to diabetes or high blood pressure, vascular disease potentially. And that lower corner in the middle shows a young family. The young woman you see there had her first heart attack after her second baby in her early 30s, probably related to high blood pressure or vascular disease, perhaps smoking. I forgot to mention smoking on the left as well. And then as you move to the center of the slide, those two pictures in the center relate to a new mom and a pregnant mom, both of whom have health conditions evidenced by their behavior or their affliction during their pregnancy related to medical conditions and health behaviors. And then as you move to the right, notice I'm moving down in age. The lower right-hand corner is a 6-year-old. Can't button his pants. That moves me. The little boy smoking the cigarette's very moving to me also. And so I present this slide to you just to illustrate why our statistics aren't getting better, why we need to act now. Poor health habits jump from generation to generation. Doesn't have much to do with genetics. It has to do with health behaviors. And so we see these diseases that used to be afflictions of old people moving into childbearing aged people who have unhealthy pregnancies. They can't raise their families well. They can't contribute productively to the workforce during a time that should be in the prime of their life. And so we've got to change that. We think a catastrophe is happening now, but we haven't seen anything. I draw you back to a different version of the pie chart just to remind you about those basic factors on the left that are inextricably combined with health outcomes, poverty related to income, race, and I just don't want you to lose that in your discussions today as we focus on healthful behaviors. Those are inextricably related to health, so please don't forget that as you make your plans for the upcoming future. And so now the concept of changing the context. I'm hoping to encourage that we change the context. We are hoping that we change the context of our discussion to talk about root causes. Let's not talk about diabetes and high blood pressure and being on dialysis and having strokes. Those are all outcomes. Let's keep those things from happening. Let's talk about reducing obesity by improving physical activity and nutrition, reducing tobacco use, and improving health management. Notice I don't have disease management there. Let's improve our health management, help people navigate to resources, perform good self-care, and talk about worksite wellness programs. Again, the three things that we're sort of narrowing your focus to are related to these three, what we would call root causes. They're to help us work on the things we know are root causes and that work so that we can focus our attention and our energies. Obesity and unhealthy weight is present in 1 out of 3 U.S. adults, almost 1 out of 5 children across the U.S. And obesity is not an appearance issue. It actually increases the risk of almost every chronic disease and every poor health indicator. Tobacco use, you know how that is. It causes nearly 1 out of 5 deaths. It increases the risk of almost every illness, disease known to man. Chronic disease, the Centers for Disease Control and Prevention calls the challenge of the 21st century. That's what health management is about. Making sure that diabetes does not result in kidney failure, non-traumatic lower extremity amputations like the gentleman you saw in the earlier slide, blindness, controlling high blood pressure or preventing it, and preventing heart disease, because they remain major causes of disability. And so kind of bolstering our choice to and our request to you to allow us to focus your attention on these 3 root causes is that the Centers for Disease Control and Prevention has made this same sort of narrowed focus their priority as well. They've named 10 things they call their winnable battles, and 3 of them are physical inactivity, poor nutrition, and smoking. The advantage, in addition to having our focuses validated by the Centers for Disease Control, choosing them as well, is that they are funding research to develop evidence-based interventions, but they've also, maybe more importantly, gathered information on interventions that work in communities and created toolkits and materials so that we don't have to recreate the wheel. There are actually things out there that work that we can access here in our community thanks to the Centers for Disease Control and others. And so as we move into Dr. Vinci's portion of the discussion, I just show you a slide with what I would posit to you as a blighted community at the top. It's not necessarily what you would think of as a blighted community, but the pictures are to represent a community where there are very few opportunities for healthful choices, for food and healthful choices for physical activity. Areas are unsafe and unsavory to perform physical activity. And again, I would like to posit to you that there are some things about our communities that make us blighted in this way. Physical activity and good nutrition are not yet norms in our communities. And then we could bloom into the kind of community you see at the bottom, where people expect to have regular routine opportunities to have physical exercise as part of every day. People don't say, well, now, why do you exercise? It's actually a regular habit in our community. And access to nutritional foods in every part of our community is a priority for our community. And then if you ask people what healthy communities are there in the United States, many people that I've asked that question respond like Colorado Springs or Denver. You know, they're well known as being healthy communities. You can almost picture a sign off the highway saying, you know, come here for a healthy life, move here, vacation here. We have beautiful beaches. We have so much here. Why can't we be known, you know, see us with a sign above the I-10 exits to Santa Rosa and Escambia counties, so that people know they can come here for a healthy vacation. They can move here for a healthy life. And so with that, I'll move into Dr. Vinci.